But first, in New South Wales this afternoon, as you just saw there, a new Premier was sworn in, and already he's promised to open up the state as planned on Monday. He said that he wants children back in school and he expects to help business back up on its feet. Talking to people in New South Wales this afternoon, the optimism is palpable. They're on the way out of this mess and they know it. Down in Victoria, it couldn't be more different as things, well, they just go from bad to worse. Yesterday was the record for the most locked up city in the world, and today it was the Australian record for the highest daily case rate in this pandemic. 1,763 new cases in Victoria today. By contrast, at the same stage in their outbreak, New South Wales recorded only 634 new cases. That's over 1,000 more cases in Victoria than New South Wales at the same stage in their respective outbreaks, day 63. Yet Victoria, well, it locked down harder from day one and New South Wales didn't. It's difficult to accept, isn't it? Tougher restrictions, yet a much worse result in Victoria. But the statistics don't lie. On the testing side too, the numbers are punishing Victoria. The test rate on day 63 in New South Wales was 102,000 tests. In Victoria, it's only 62,000 tests, meaning a much higher COVID infection rate in Victoria, even with around half the tests. You can see why Melburnians have had enough, haven't you? The lockdowns haven't made any difference. And in fact, compared to Sydney, things are only getting worse. Are Melburnians over it? You bet they are. Polling out today says a majority of Victorians believe the economic costs of lockdowns are worse than the health risk. Less than a third disagreed with that proposition. Even with these record numbers today, Daniel Andrews says he expects Melbourne's lockdown to end around October 26. That's still another 3 weeks away. Yet if the predictions are right, cases in Victoria could be up around 3,000 a day by then. Already there are reports that hospitals are scrambling fast to try and find extra beds. Honestly, Victorian taxpayers have got every right to ask what on earth have their government and the public service been doing up until now if it isn't ready, 18 months in, for hospital admissions. With cases going up in Victoria while cases are going down in New South Wales, a less restricted state, only one conclusion is possible, that New South Wales is better than Victoria at testing, tracing, vaccinating and ramping up its hospital system. But it doesn't just stop there. One thing this pandemic has given us all is a bit of a front row seat, isn't it, into the varying levels of competence that we've got in our state governments and politicians. In WA, their health system is also in trouble. Even without any cases of COVID, the president of the WA Doctors Association, Dr. Mark Duncan Smith, the AMA, says that the state's hospital system is on its knees. It was only recently the two major Perth hospitals were simultaneously on code yellow, so that's internal emergency level code yellow, with another hospital almost there. In August, patients in ambulances spent over 6,000 hours waiting outside emergency rooms in WA. Medical staff, they report being broken and demoralised. That's what chronic hospital system failure looks like. And remember, WA haven't even got Delta there yet. You've got to wonder, don't you, where that Premier has been spending all the mining billions. Move across the country to Queensland. Today there, the AMA is reporting that despite months of closed borders and, again, very little COVID in the state, Queensland hospitals too are, quote, at breaking point, with 31 cases of hospitals needing to divert ambulances over the last month alone. Again, virtually no COVID. For many years, Labor has always traded on its brand that it runs hospitals and health systems better than the Liberals. But as important as the money is, it's how you spend it and where you spend it that makes a difference. What does it say about Labor's trustworthiness in Victoria, WA and now Queensland that 18 months into this pandemic, their hospital systems still aren't well prepared enough to cope with COVID? Today, Annastacia Palaszczuk and her Queensland Health Minister tried to blame it all on Scott Morrison.
As we know, these are pressures that are being felt right around the country. That's why the health ministers wrote that letter to the federal health minister. These are extraordinary times and the pressures are not unique, and other premiers also raise these issues at National Cabinet.
There's actually 3 letters sent to the Commonwealth Health Minister, and every single state and territory health minister has signed that. So this is a national conversation. It's not a fight between the Commonwealth and Queensland.
Sorry, they think you're stupid here. The others are coping, but they're not. The Liberal states are coping, the Labor ones are not. See this for what it is. There has never been more money coming from Canberra to the states, never in Australian history. This is just a desperate attempt at distraction from a desperate Premier in Queensland and her desperate government that have been caught out. I don't think I'm the only one who wishes they were in Sydney at the moment. 6 days from freedom, wouldn't that be lovely?